Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching. Have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Bala Simon. He is the Deputy Chief Medical Officer at the Arkansas Department of Health. Dr. Simon, thanks so much for being here.
Well, thank you for having me today.
So we're talking about stroke. What are the most common risk factors for stroke, and how can they be managed or reduced?
That's a great question, and it's a great topic this month because February is the American Heart Month, and the stroke is one of the leading causes of death in Arkansas and in the nation. About close to 20% of heart disease deaths are due to stroke. And when you talk about the common risk factors for stroke and the unfortunate nature it causes for the individual who has stroke and the family, the leading risk factors are high blood pressure, high cholesterol, diabetes, family history of stroke, and then the behavioral factors. Heart disease can increase stroke too, particularly those with the atrial fibrillation or heart rhythm problem increases the stroke risk. But behavioral factors like smoking, excess smoking, drinking, or any other drug use can increase the risk of stroke as well.
And there are two different types of stroke. What are the differences?
So commonly there are two different types of stroke. One is called the ischemic stroke, which is the most common one. It is due to blockage in the artery which supplies the blood to the brain. That causes ischemic stroke. Blood carries the oxygen to the brain, and oxygen is vital for the cells of the brain, and brain is like an electric circuit that controls the body. So when the blood supply to the brain and hence oxygen decreases, you get an ischemic stroke. About 80 to 85% of all strokes are due to ischemic stroke. The other type is called the hemorrhagic stroke, where the blood vessel to the brain ruptures and there's bleeding within the brain. And that can be very dangerous, and people can die right away. So both strokes, these are the two common forms of stroke.
And how do the prevention strategies vary between the two?
Well, while the common risk factors are pretty common for both of them, and so is the prevention strategies are common. We advocate for some behavioral modifications, particularly checking your blood pressure. You know, I tell my patients every day, high blood pressure is a silent killer. So people don't recognize that their blood pressure when it's high unless it is very high enough to have them to have a chest pain or have some facial drooping or unable to feel one side of the body. And then they, lo and behold, find out that they have a very high blood pressure. So that is an important factor. It is important. That's why we need to, patients and people need to see their doctor to check their blood pressure under control. High cholesterol, diabetes, it's very important to keep these under control. Of course, the behavioral factors like not smoking, drinking, or doing any other drugs, and preventative visit to the doctor can take them miles in prevention for stroke.
And what role does stress and mental health play in the risk of stroke? Are there many strategies to manage those factors effectively too?
Absolutely. As I said, this is the American Heart Month, and heart, in a sense, which supplies the blood to the brain, are all connected, and stress and mental health plays a huge role. We have stress hormones like cortisol or epinephrine, which is, cortisol is secreted throughout the day. And also epinephrine, which is the flight hormone. or enzyme. So when the body responds to stress, and when their blood circulation is pumped, heart pumps faster, there is always an increased risk of bursting out clot or heart rhythm abnormality causing AFib and stroke or rupture of the blood vessel from the heart. So stress is a major factor, and in this day and age, it is with so much going on with the social media, with the online engagement, with so much noise around. It is important to take time for oneself to de-stress, and there are several strategies one can de-stress and take care of their stress to prevent any strokes or heart attacks in future.
Are there certain age groups or populations that are at higher risk for stroke?
Absolutely. Unfortunately, the risk of stroke doubles every decade after the age of 50 or 60. So older one gets increased risk of stroke. Of course, the compounding factor is the some of the medical conditions, which happens as a consequence of aging as well. High blood pressure, diabetes, cholesterol. So age is an important factor which increases the risk of stroke.
How can someone recognize the early warnings of stroke, signs of stroke, and why is quick action crucial?
So we use an acronym BFAST for stroke identification. Stroke is also known as brain attack. So every second matters. Brain cells can die and they do not regenerate. So it's important earlier intervention. So identifying the signs and symptoms of stroke can make a difference between life and death. We use the acronym BFAST, where the letter B stands for balance. If one is suddenly losing a balance or losing consciousness, that's a red flag. E stands for eye movement. If there is a sudden change of vision or trouble seeing, that can be a problem. F stands for facial drooping. People commonly recognize this symptom more than anything else. The face drooping. They wake up in the morning, they find that one side of the face is drooping, or the corner of the mouth, the food is dripping from the corner of the mouth. A stands for arm weakness. This is another common sign. When they wake up, they are unable to lift their arm or leg off one side of the body. S stands for speech difficulty. They try to say something, but the words don't come out, and they are impaired because they are unable to express. So speech difficulty is one. And T is time. Time to call 911. If they have any of these symptoms, this is not the time to get on the car or use the next of the kin to drive to the hospital. This is the time to call 911, use the EMS to arrive at the hospital, because every second counts. Unfortunately, for every 30 seconds in America, we have at least one person suffering from stroke. Every 3 to 4 minutes, one person died due to stroke. And in Arkansas, last year, we had close to 1,800 people die due to stroke.
So what role does family history play in stroke risk?
So family history plays an important role, particularly as it relates to the heart risk factors. People who have high blood pressure risk factors are certainly inherited. So it's important to know that diabetes, high cholesterol, and anyone who had the father or sibling who had died under the age of 50, the early deaths, that's a red flag or sign that one need to go to their doctor to get their health checked to look at the risk factors for stroke.
And can you discuss any recent advancements in stroke prevention or new treatments that could help at-risk individuals?
Absolutely. So there's a prevention side of it and there is treatment side of it. Now, prevention side, we talked about changing the lifestyles, not smoking, drinking, and not doing any drugs. maintaining fairly healthy lifestyle, a good diet, reducing the red meat consumption. A number of days consuming red meat in a week can go a long way, along with encouraging more fruits and vegetables in the diet. Lean meat like chicken, poultry is helpful, and engaging in regular physical activity is very important. And physical activity is very underrated for a lot of reasons because it is also a natural stress reliever. Because physical activity releases endorphins, and it's a feel-good hormone. Endorphin is a feel-good hormone, so it reduces the stress, calms the helps with the mental health. So it's important to engage in physical activity and maintain a fairly good lifestyle for preventing. And when it comes to treatment, I think we have come a long way in the last 20, 30 years. We have a lot of clot busting medications to prevent. I mentioned to you about 80 to 85% of the stroke are due to the blood clot in the brain vessel. And we have clot busting medications which can be given within certain time. That's the golden hour when they reach to the hospital on time, and they can be administered. And I have seen people walk out the very next day from the hospital without nothing happen. So we have come a long way, and the side effects of these medications are far and few now compared to when it came out in 30 years ago. Also, we are recognizing large vessel disease. The strokes or the clots which are occluding the large vessels, we are recognizing early, and we have endovascular treatment. In other words, similar to the heart cath, they can do brain cath and remove the clots in the big vessels, and the people can recover with minimal or no symptoms at all. So we have come in a long way, but time is essence. We talk about time is brain. This is very important to avail.
It's incredible at how effective those treatments are and make such a difference.
It does. Back in the until about 70, from 50s to 80s, stroke used to be the number second leading cause of death. Arkansas was ranked number one until 2010. Now we are ranked number 9th or 10th. We still have a long way to go, but we have come a long way since we were leading the stroke deaths in the nation.
How often should individuals check in with their healthcare providers regarding stroke prevention? Is there a set of screenings or tests that are the most important?
So stroke prevention falls under the general heart prevention. As I mentioned, I think every individual needs to see their doctor, the primary care doctor, at least once a year to make sure that their blood pressure is normal, their cholesterol is under control, they do not have diabetes. The physician or the healthcare provider can screen them for family history, for any modifiable conditions, and have a blood test done to check all their biomarkers are within the normal limit. We take our cars every 3,000 or 5,000 miles for service. Our body is no different from a car. So, people tend to postpone their doctor's annual visit. Well, I'm feeling fine. I'm okay. But it's an ounce of prevention is worth a pound of cure. So it is important to have these regular annual visits with their physician. And it's even more important as one ages because your risk factors and things accumulate. And so that's where the emphasis on is prevention is very important. And there are things they can do identifying the risk factors, and if they need to be on medications for blood pressure or diabetes or high cholesterol, and that can go a long way in preventing them stroke risk.
Now, are there any misconceptions about stroke prevention that you'd like to tell our audience? Are there some out there?
There are some misconceptions. People call them the mini strokes or TIAs, and oftentimes they are a sentinel event. People who develop these are more at risk of developing a full-blown stroke. Ignoring some of these early signs is very important. People have a misconception, oh, well, it's just a momentary thing. No, it's not a momentary thing to lose vision or have a facial droop or whatnot, and they recover. Because sometimes a stroke happens in small vessels where they may have a momentary lapse of symptoms and then they regain fully. So they cannot ignore these early warning signs or the misconceptions. And the other common misconception is there's nothing we can do about it. That is not true at all. As I mentioned, we have come a long way in stroke prevention, stroke treatment, and unfortunately, to this day, stroke is the leading cause of not just the death, but also the long-term care admission. People are bedbound in nursing home, and that's an unfortunate thing to survive a stroke and to be bedbound, paralyzed, and it takes a hard toll on the family and the friends.
What advice do you have for people with a family history of stroke or those who've already experienced a minor stroke in preventing a full stroke in the future?
And again, family history is very important. Knowing what you're at risk and talking to your doctor about it and having a plan to take care of the health and have some goals in taking care of the health can go a long way in preventing stroke.
And what are some final thoughts as we close? Some of the public health interventions that the Arkansas Department of Health has been involved in with stroke prevention in the state. There are several.
There are several happening in the state. We do a lot of public education through the signs and symptoms of stroke, like the Be Fast. We have billboards, lanyards, and others to educate the public. We do a lot of professional education. We work with the UAMS, Institute of Digital Health and Innovation, to promote the messages about the stroke to both the public and to the healthcare professionals like the EMS, the doctors, the nurses, and all, to keep them up with the most current stroke prevention and treatment strategies. We also designate hospitals through the health department called the Acute Stroke Ready Hospital designation. We have thus far designated 30 hospitals across the state, primarily rural hospitals who have less resources to go for a Joint Commission designation. The designations help, is a testament of their quality of care of stroke treatment they do. We have a stroke registry at the health department. We track all individuals who encounter stroke. We work with the healthcare team in improving the care for stroke across the state. So we have a number of things happening in the state at the professional level and at the public level. But the key message to the public, and this is what I tell my patients, is people have to take their health seriously, and with the American Heart Month this month, our heart and brain are the key elements of our survival. So prevention is the key. Lead a healthy lifestyle. Check with their doctor, make sure that their family history, their risk factors, and any of their blood pressure, cholesterol, and diabetes are all kept under control. And that will go a long way in preventing this devastating disease called stroke.
Well, Dr. Simon, thank you so much for sharing this important information.
Thank you. Thank you for having me.
Today I have with me Stephanie Whitaker, and she's the Chief Nursing Officer at Mercy Hospital Fort Smith Communities. Stephanie, thanks for being here.
Thank you, Robin. I appreciate you having me on.
So we're talking about nursing today in the workforce. Can you describe the current state of nursing at Mercy Hospital Fort Smith? And you're doing some really innovative things.
Well, thank you. We are exciting. Nursing is building a future here in the River Valley, and it's a complex and challenging process with the nursing shortage across the nation. But we're navigating this with forward thinking, innovation, and really engagement with our nursing community and with our students, starting even at the eighth grade level to get them engaged in healthcare.
So what do you believe are the primary factors contributing to the nursing shortage? It's not just local, right?
No, it's not. We're still coming out of the pandemic, from the COVID pandemic, and there's still some challenges related to that. We saw a lot of healthcare professionals that retired during that season, and when we were already in a shortage, and then have early retirements, or people make complete career changes based on the pandemic and the effects that it had on their well-being, mental health, and their financial situations. They left healthcare. So we're still moving forward out of that. We also have challenges with nursing schools having enough trained faculty to add students to their programs, which then in turn delays getting us new nurses at the hospital or clinics anywhere across the nation. So really, academic faculty and just really building that pipeline is what we need. There's the challenges of the shortages.
And how has the shortage affected patient care and nurse workloads at your facilities?
Coming straight out of the pandemic, the nurse workload, I would say, was much higher because of the challenge of that gap. And we had a lot of agency or contract labor. And those team members were traveling all across the country to help support patient care. So at that time, there were a lot of stretched ratios, meaning that nurses were taking care of more patients than what they typically cared for, just to meet the needs of the patients in our community. Those have come back down. We've been very successful in bringing those back down to normalizing ratios that are standards across the industry. But the acuity of the patient is still very high because there are a lot of side effects from those who receive COVID and ongoing chronic illnesses and challenges. Our patients across the country just continue to get sicker when they're in the hospital and have more challenges. So we're here to meet those needs, and that does bear a burden on the healthcare workers, especially the nurses who are with the patients 24/7.
And you touched on this a little bit, but what are strategies that Mercy Hospitals implemented to attract new nursing talent?
We have several strategies. So we start very early in elementary and middle school, talking with students about healthcare, going to career fairs, trying to get them engaged in what an amazing profession healthcare is, specifically nursing. It's certainly a passion of mine. And then we have a middle school program, a health science middle school program with Darby middle school, that is here on campus. So they actually are immersed on the campus and do their education here when they're in 8th grade. So we have that. So we're able to engage them and have them experience healthcare from a different lens while they're in school. And then we partner with many academic programs, whether it's our high school program, Peak, where they train LPNs and CNAs. That is a high school program that we engage. So when they graduate from high school, they can actually have a licensed practical nurse degree. They can also have a certified nurse degree or an EMT degree. So those are some ways that Mercy partners with our Fort Smith public schools. Then we move to the academic level. And so we have multiple academic partners, whether it's the University of Arkansas Fort Smith, Arkansas Tech, Carl Albert in Oklahoma, and many other partners that we allow and invite, really not just allow, but we really welcome them to come to our facility and do their clinical rotations here. That gives us an opportunity to engage, train those nursing students, and really invest in them. One specific program we have to address these needs is we have a dedicated education unit, and that's for nursing students to work on a unit side by side with a Mercy nurse. The two of the student and the Mercy nurse take care of 4 patients together. 2 students, 1 Mercy nurse, 4 patients. So each nursing student really has 2 patients that they can really focus on and learn all of their skills and assessments at the elbow with that Mercy nurse leading them. And it's been very successful in helping them become more practice ready.
Yeah, what incredible experience. And starting at such a young age.
Yeah.
So, how are you working to retain experienced nurses and reduce turnover? Is that something that you're seeing?
Absolutely. It's something we're very focused on because we have to retain our top talent. Our caregivers are essential and they're with the patient 24/7. So we want to make sure that we give them all the resources they need to do their job as easily and efficiently as possible. We also work on focus groups to find out what their needs are and what changes. Each generation has some different needs and different focus. And so we have to adapt at Mercy to try to meet those needs. So we have some flexible scheduling, different workforce layers, and we also try to give creative ways, like on our dedicated education unit, that experienced nurse is training new nurses so they have a lower workload, less patients. So it gives them some fulfillment to give back and train nurses. And that's helping with some of that resiliency and reduce burnout because they can pay it forward and invest in these students and get some joy back in why they went into nursing. Those are just a few of the strategies we're using.
And it sounds like mentorship, support programs play a vital role in that.
Absolutely. That's essential. And so we have a mentorship program, which is a part of our residency program that as you start, when you onboard as a Mercy nurse, you're placed into a nurse residency program that is 12 months. And so you are with a cohort, a group of nurses like you, maybe not in the same department, but experiencing the same things. And then you have touch points all throughout that year with multiple different nurse leaders and support. You have a preceptor program, you have a charge nurse, a supervisor, a manager, a director, and even myself that engage with you throughout your journey becoming a new nurse. So those mentorships don't start there. We connect you and move you forward with that growth and opportunities.
Have you adopted any technological solutions, like is virtual nursing, telehealth, all of those things to alleviate staffing challenges too?
Absolutely. So Mercy has a virtual care center in St. Louis that there are nurses there that help support us actually here in Fort Smith with things like sepsis alerts and critical care monitoring, things like that help us. We also have a partnership with Epic and Microsoft to bring ambient technology to the bedside, to the frontline caregiver, where the nurse can really focus in on that patient care. They have a device that actually helps hear the conversation between the nurse and the patient. Of course, it's pre-approved with the patient's permission, but it's hearing the conversation. So you and I can have a conversation about your assessment. And in the background, this AI technology with Microsoft and Epic is pulling those key information in, pulling it into your chart. We can talk about our favorite football team or basketball team. It will not pull that information in the chart. So we can have a conversation that's very meaningful while also getting the very detailed clinical information that we need to be successful in your care and in care planning. Pulls that information in, and then the nurse goes back and validates that information is correct, which is amazing. It shaves off about 2 hours of that nurse's time of their 12-hour shift. So it's taking that cognitive burden off the nurse so they can really provide that compassionate care and exceptional service, while at the same time having a better quality documentation for our other caregivers, our physicians, our case managers, our physical therapists, our respiratory therapists. They can immediately see the documentation. They don't have to wait for me to go back to a computer, find a desk, sit down, remember everything we just talked about, or take something from my notes and put in. It automatically goes in. So it also gains efficiency with our other caregivers, not just the bedside nurse.
Wow, that's a game changer in a number of ways. Really incredible.
Yeah, we're piloting it, so we're excited to see. So we'll be starting that. We've started it in St. Louis. We'll be bringing it to Fort Smith in the next few weeks and pilot it on units, and then we hope to have it successfully disseminated through all of our nursing units.
So is Mercy Hospital also exploring flexible scheduling, like part-time opportunities to accommodate diverse workforce needs? Is that something that you see in demand as well?
Absolutely. As we talked about the generations, everyone has different needs and seasons in their life based on what's happening. So we've created multiple workforce layers. One of those is called a gig workforce layer, and it's through Mercy Works on Demand, which is an app that we have. And so if I'm a gig nurse, that means I'm not required to work a specific amount of hours in a week. I can pick up to 30 hours a week, or I can pick up no hours based on what's going on. If I have childcare challenges, or if I have an aging parent that I'm trying to care for, or if I want to go on a vacation and I don't need to be, I can be a gig nurse, pick up those shifts in the app immediately, and then come to work. And that is for experienced nurses. Our new graduate nurses, we work with you on what the track is and what you need, and kind of work on what are the best needs to meet our patients, and what to get you trained and practice ready to the best of your ability to move from that novice nurse to that expert as quickly as possible.
So many innovative programming, starting from education at really young ages, and even like middle school, junior high, up to now, partnerships with schools, education, and mentoring. So many programs that really sound like they're making a difference within your hospitals, for sure. So what are you hearing from new nurses about their experience starting their careers at Mercy, and how has that feedback kind of shaped your approach?
Absolutely. So we absolutely survey our nurses, and we have at the elbow conversations of what's working well, what's not working well, how can we better meet your needs. And as we get that feedback, we continually adjust our residency program, our orientation, our preceptor programs, our mentorship. We take that and feedback. Right now, I would say, like I said, we're still coming out of COVID. There's some nurses that during COVID, they didn't get a lot of hands-on with patients because the schools were closed down. And so they were doing a lot of virtual learning. They were doing a lot of sim learning with mannequins. And so we're still partnering with those new nurses to get them more hands-on experience and help build their confidence and skill level to care for those more complex patients. So that's an ongoing approach to those nurses and their needs.
Well, Stephanie, thank you so much for talking about this important work. And I appreciate you being here today and sharing the future of nursing at Mercy Health. Thank you.
Thank you so much. We couldn't do what we have done with these innovative programs without the support of the Arkansas legislation and the Align grant and support that we received. That has been so beneficial in helping us increase our nursing pipeline, and we're very thankful to receive those funds from the state government. Thank you for your time. I appreciate being with you.
Yes, thank you. Thanks so much for being here. And that's it for AFMC TV. Have a great day. Thanks for watching.